Hello everyone, my name is Diana and I'll be presenting the synergy model of nursing care along with David and Minna. Hi everyone, this is Diana Mohamad and I'm going to be identifying the theorists who developed the synergy model. So the synergy model was primarily developed by the American Association of Critical Care Nurses, or the AACN, as they're more commonly known, with significant contributions from nurse researcher and theorist Martha A.Q. Curley. The AACN created a framework that aligns the competencies of nurses with the needs of the patients, therefore optimizing patient outcomes. Curley is a renowned nurse researcher and professor known for her work in pediatric critical care. That's just some background on her. Her research and publications demonstrate how the alignment of nurse competencies with patient needs can lead to improved patient outcomes.
Hello everyone, my name is David and I'm going to talk to you about the unique focuses of AACN Synergy Model for patient care. First one is matching the needs of patients to the competencies of transport care providers during the intrafacility transfers. Number two is using patient characteristics like stability, complexity, vulnerability, etc. to determine the appropriate level of care and provider skills needed during transport. Number three is extending the nursing continuity of care from the sending facility to the receiving facility by having transport nurses with the right competencies care for patients during transfers. Number four is providing an objective, theory-based framework to guide decisions about the level of care and staffing needed for a safe intrafacility transport rather than relying solely on provider intuition or experience. Number five is adapting an established nursing model focused on patient needs and nurse competencies to the specific context of critical care, transport decision making. The key innovation is applying the synergy model patient-centered approach to transport triage, aiming to match patient needs with provider competencies to optimize outcomes during the vulnerable period of intrafacility transfers.
Hi, my name is Minna Sanchez, and I'm going to be talking about why our group chose to focus on the synergy model for our presentation. The synergy model represents a fundamental theory that aligns nurse competencies with patient needs, ensuring individualized and effective care. This theory is pivotal for understanding how to optimize staffing levels based on patient acuity and nurse expertise, which is crucial for patient safety and positive outcomes. As nurses, we often find ourselves short-staffed, and we find ourselves in situations that are unsafe for our patients. And the synergy model helps to combat this. Exploring the synergy model allows us to delve into its application across diverse settings, highlighting its role in promoting evidence-based practice and continuous professional development. By representing on this model, we aim to deepen our own understanding and educate others on its significance in enhancing nursing practice and improving patient care quality.
Okay, it's Diana again. I'm going to be talking about the evolution of the synergy model. So we're going to go ahead and start in the 1990s, and this was a time for conceptualization by the AACN. So the AACN recognized the need for a framework that could better align nurse competencies with patient needs in order to improve patient outcomes. Their primary goal was to create a model that would enhance patient care by focusing on unique characteristics of both the patients and the nurses. Fast forward to 1998. This is a time for development and validation. So Martha A.Q. Curley's work provided a theoretical foundation and empirical evidence supporting the model's effectiveness in improving patient outcomes. And then we're going to go to 2007. This was a time for publication and dissemination. So Curley, in collaboration with the AACN, published a comprehensive book about the synergy model its theoretical underpinnings, and practical applications. This publication helped to disseminate the model widely within the nursing community and facilitated its adoption in various clinical settings. So, from the 2000s until now, we're still practicing integration into nursing practice and education. So, the model's focus on matching nurse competencies with patient needs has been shown to enhance patient outcomes, nurse satisfaction, and overall healthcare quality. And this model has been integrated into nursing practice and education, with many healthcare organizations adopting it as a framework for improving patient care. So by aligning nurse competencies with patient needs, the synergy model continues to enhance patient care and outcomes, reflecting its enduring relevance and impact in the field of nursing.
So for the next slide, is theorist the motivation for developing the adaptation of the AAC and synergy model. The first one would be lack of standardized guidelines. The author identified that there were no universally accepted clear guidelines for making informed triage decisions about interfacility transport. This gap in practice led to inconsistent and potentially suboptimal transport decisions. Number two is inadequate consideration of patient factors. The author noted that the patient-related factors such as predictability and complexity or transport factors like adverse weather conditions were not consistently addressed in transport decisions. Number three is over-reliance on provider discretion. Typically, the interfacility transport decision was left to the discretion of the referring provider, who may not have been aware of all available transport options or level of care. Number four is need for patient-centered approach. The authors recognize the necessity of determining the appropriate level of care required to meet the specific needs of patients during transport rather than using a one-size-fits-all approach.
Philosophical beliefs and values collectively shape the synergy model, guiding nurses in providing compassionate, competent, and effective care that respects the dignity and autonomy of each patient while striving for excellence in nursing practice. Some of the beliefs and values that synergy model has are holism, which embraces the patient as complex individual with physical, psychological, social, and spiritual needs, emphasizing the importance of addressing all these aspects in order to promote healing and provide optimal health outcomes. The next is evidence-based practice. So this is a belief that we should promote evidence-based practice. As nurses, we need to integrate current evidence and research findings into our practice. It supports making clinical decisions and interventions based on what's the best information available to ensure safe and effective patient care. Professional development. So for professional development, they advocate for nurses to have competence and expertise and continuous professional development. It focuses the critical role that nurses have with clinical judgment, critical thinking skills, and ethical decision-making in order to provide high-quality care. Health equity. So the synergy model also advocates for nurses to be advocates for patients' rights, dignity, and access to care, promoting social justice, equity, and fairness in healthcare delivery, while upholding ethical standards as well. Interdisciplinary teamwork. So the synergy model is focused on a collaborative and interdisciplinary care team. It focuses on how we need to have effective communication and shared decision-making to achieve synergy between nurses' competencies and patients' needs. And patient-centered care So the synergy model, at the core is the belief that individualized nursing care that is tailored to meet each patient's specific unique needs and preferences will help them with healing and help their autonomy and cultural background should also be considered in decision making and the delivery of patient care.
Okay, it's Diana again. I am going to discuss a list of the key concepts of the synergy model, and I'm going to be defining them. So, key concepts of the synergy model include two major categories: patient characteristics and nurse competencies. So, under patient characteristics, we have resiliency, which is defined as the patient's capacity to return to a restorative level of functioning using compensatory or coping mechanisms. And we have vulnerability, which is defined as the susceptibility to actual or potential stressors that may adversely affect patient outcomes. Stability, the ability to maintain a steady state of equilibrium. Complexity is the intricate entanglement of two or more systems, such as the body, family, or therapies, all merged together. Resource availability, which is the extent of resources, technical, physical, personal, psychological, and social, that the patient, family, or community bring to a certain situation. Participation in care is the extent to which the patient or family engages in aspects of care. Some may participate more than others. Participation in decision making, the extent to which the patient or family engages in decision making processes. Again, some might want to participate more than others. Sometimes the patient doesn't really participate. And predictability is the characteristic that allows one to expect a certain course of events or course of illness. So the nursing competencies. Clinical judgment is defined as clinical decision making, critical thinking, and a global grasp of the situation coupled with nursing skills. Advocacy and moral agency is defined as representing the concerns of the patient, family, and community, serving as a moral agent in identifying and helping resolve ethical and clinical concerns. Caring practices, creating a compassionate, supportive, and therapeutic environment for patients and staff. Collaboration, working with others toward achieving optimal and realistic patient goals. Systemic thinking, the body of knowledge and tools that allows the nurse to manage whatever environmental and system resources. Response to diversity, the sensitivity to recognize, appreciate, and incorporate differences into the provision of care. Facilitation of learning, the ability to facilitate learning for patients, families, nursing staff, other members of the healthcare team, and the community. Clinical inquiry, the ongoing process of questioning and evaluating practice, providing informed practice, and innovating through research and experiential learning.
The nursing paradigm encompasses four essential concepts that shape the practice of nursing: person, environment, health, and nursing. So, as far as the person, the synergy model sees human beings as individuals with unique needs and characteristics. The model emphasizes the importance of holistic care that considers not only physical health, but also psychological, spiritual, and cultural dimensions of individuals. Each patient is viewed as a whole person with inherent worth and the potential for growth and healing. For environment, the environment and synergy model includes both the physical surroundings, such as hospitals or the home or clinic, and the broader social, cultural, and organizational contexts that influence patient care. It acknowledges that the environment can impact patient outcomes and the delivery of nursing care. For health, I'll differentiate between wellness and illness. So health within the synergy model encompasses a continuum that ranges from wellness to illness. Wellness is viewed as an optimal state of well-being that individuals strive to achieve through self-care and preventative measures. Illness, on the other hand, represents a disruption of health requiring nursing interventions that promote healing, manage the symptoms, and support recovery. The goal of nursing in the synergy model is to provide holistic, patient-centered care that addresses the unique needs and preferences of each individual. Nurses in the synergy model are advocates, educators, facilitators of health who collaborate with patients and other healthcare providers to promote well-being and achieve desired health outcomes.
Okay, this is Diana again. I'm going to present a research study that has utilized the synergy model as a conceptual framework. So this research study by Swickard et al. In 2014, titled Adaptation of the AACN Synergy Model for Patient Care to Critical Care Transport. So this study adapted the synergy model to the context of critical care transport, aiming to enhance patient outcomes during interfacility transport. We all know how difficult that can get sometimes. So the synergy model's framework was applied to assess patient acuity and match it with nurse competencies, ensuring optimal care delivery during transport. So the researchers adapted the model to assess patient acuity levels during transport and matched them with appropriate nurse competencies, optimizing patient care delivery. And that is how they applied the synergy model. So the study demonstrated improvements in patient safety and outcomes, highlighting the model's effectiveness in guiding practice and enhancing care quality during transport. By aligning patient acuity with nurse competencies, healthcare providers can optimize care delivery and improve patient safety and outcomes in challenging transport situations. Swickard et al. Concluded that the AACN synergy model for patient care can be successfully adapted to the critical care transport environment. The study demonstrates that the model's principles are flexible and can be applied to different nursing contexts to enhance patient care and outcomes.
All right, so for the next slide, this is our clinical scenario. It's a 48-year-old man with a history of chronic obstructive pulmonary disease, coronary artery disease, and hypertension, was admitted to a community hospital ICU with uncompensated heart failure. His condition worsened, developing a frequent ventricular tachycardia and hypotension, requiring vasopressor support. The treating provider decided to transfer the patient to a tertiary facility for further evaluation and possible heart transport evaluation. So the application of the transport triage tool that was used, the nurse practitioner on the transport team completed a transport triage evaluation using the adaptive synergy model. The patient was evaluated on 8 characteristics: resiliency, vulnerability, stability, complexity, resource availability, participation in care, participation in decision-making, and predictability. Each characteristic was assigned a level 1 through 5 based on the patient's condition and needs. The complete triage evaluation found 6 categories at level 1, 1 category at level 3, and 1 category at level 5. Decision-making based on this evaluation, it was determined that the patient required a provider level of care during transport, specifically an advanced practice registered nurse. The rationale behind this: the patient's high level of complexity and low stability required advanced clinical judgment and systems thinking. The need for precise arterial pressure monitoring and potential medication adjustments during transport required the prescriptive authority of an APRN. And the patient's vulnerability during transport and the potential for complications necessitated a higher level of care than a registered nurse or paramedic could provide. The outcome: this application of the adaptive synergy model allowed for systematic patient-centered decision about the appropriate level of care during transport. It ensured that the patient's specific needs were matched with the competencies of transport provider, potentially improving safety and outcomes during the inter-facility transfer. Okay, so for my last slide, we'll be talking about the strengths and weaknesses of the synergy model. The first of the strength is a patient-centered approach, focuses on matching patient needs with provider competencies. Number 2 is objective decision-making, provides a structured framework for transport triage and reducing reliance on subjective treatments. Number 3 is comprehensive assessments. It considers multiple patient characteristics and nurse competencies. Number 4 is adaptability. Successfully adapts an established nursing model to a new context, which is in this case critical care transport. The next one would be for weaknesses. The 4 I have are complexity. The model involves multiple factors which may be time-consuming to assess in urgent situations. Number 2 is lack of empirical validation. The adapted model is still theoretical and therefore needs further research to validate its effectiveness. Third one would be resource limitations. So smaller facilities or rural areas may not have access to all levels of transport providers suggested by the model. And my fourth one is time sensitivity. In emergent situations, there may not be enough time to fully apply the model. So overall, while the adaptive synergy model offers a promising approach to critical care transport triage, it requires further research and refinement to address its limitations and prove its effectiveness in real-world applications.
Hi, so I'm going to talk a little bit about contributions that the synergy model can have in 3 areas. The first will be nursing practice. So nursing practice can be improved by utilizing the synergy model, which encompasses individualized care through aligning patient needs with nursing competencies and conducting holistic assessments that encompass medical, psychological, spiritual, and cultural aspects for comprehensive planning. The model advocates for appropriate staffing levels to achieve optimal nurse-patient ratios, ensuring safe and effective care delivery. Additionally, it supports ongoing professional development, recognizing nurses' clinical expertise, and provides a versatile framework applicable across diverse health care settings, thereby enhancing overall care quality and patient outcomes. The synergy model emphasizes individualized learning that aligns nurse competencies with patient needs, promoting effective care delivery through ongoing professional development and education, and recognition of nurses' critical thinking and clinical expertise. This fosters a lifelong learning and professional growth within the nursing practice. Lastly, the synergy model's overall contributions to research. The synergy model of nursing facilitates research by offering a standardized framework to evaluate nurse-patient relationships and the alignment of nurse competencies with patient needs. This structured approach supports studies on staffing decisions, quality improvement initiatives, professional development, and evidence-based practice across diverse healthcare settings. 3 questions our group would like to leave you with. Number 1, how does the synergy model theory enhance the understanding in patient outcomes in various clinical settings? Number 2, what ethical considerations arise when balancing the potential benefits of a higher level of care during transport against resource allocations and healthcare equity issues? Number 3, how does the synergy model enhance patient care outcomes in nursing practice, particularly in terms of matching patient needs with nurse competencies across different care settings? Thank you for your time.